want to go ahead and welcome everyone to the Hemophilia Council of California's webinar this evening, Growing Up, Healthcare Transitions in Your 20s. My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. I want to welcome you this evening. And thank you for joining us. Want to also take a brief moment to thank our sponsors for providing support that allows us to carry on this webinar series throughout the year. Okay, with that, I just want to take a brief moment for anyone who might be new to us to introduce the Hemophilia Council of California. HCC coordinates statewide access, education, and advocacy efforts on behalf of individuals living with bleeding disorders and other rare conditions. And our advocacy is focused around advocating to protect access to care and promote progressive treatment options and advance the quality of life for those individuals, families, and their caregivers. So similarly to what we just stated, that is our mission, to improve access to care and treatment options, and really to be able to do that along with the other bleeding disorders organizations within the state of California, as well as other patient groups that we collaborate with. And our vision is really open access to quality and innovative care and treatment of choice for all people with bleeding disorders. So with that, we're going to jump in to our topic for this evening, and I would like to introduce two of our advocacy and access ambassadors who are with us this evening to really share a little bit about themselves and their experiences as we talk about what some of these transitions that we face as we go through our healthcare journey, and particularly the transitions that we face in our 20s. So Carson, if you want to take a moment or two to introduce yourself, and then you can toss it over to Leslie.
Sure. Well, hello, everybody. As you can already see, my name is Carson Knight. I'm one of the many advocacy and access ambassadors that works with the Hemophilia Council of California, both in helping develop resources like this webinar that we're doing right now, or in some of our state advocacy in helping ensure that there are policies to protect everybody and make sure that we have access to resources and education on health insurance and health care so that we can get access to the care that we all need. I, through the Hemophilia Council of California, was inspired to go study politics to help speak for the bleeding disorders community. And now I'm seeking to enter into the state government for that exact same reason, to help make sure that folks have all of the access and the support that they need from the state to access all of the care that they need. So with that, I will toss it over to Leslie.
Hi, everyone. My name's Leslie. I am 21 years old. I have von Willebrand's disease, and just like Carson, one of the main reasons why I decided to go into political science is because of this. I want to be able to help those in ways that I wish I could have helped myself and gain knowledge, and this is a perfect way to do it.
Awesome. Thanks, guys. So I'm just going to make a brief plug based on both Carson and Leslie's comments. It's not really our primary purpose for this evening, but you've heard us mention that Carson and Leslie are advocacy and access ambassadors, and they didn't specifically say, but they kind of both alluded to the fact that I think they both formerly participated in our Future Leaders program as well. And so for those of you that might be interested in getting more involved in advocacy and learning more about what that looks like, gaining some skills in terms of how to tell your story and how to advocate for yourself and your community, we do have the Future Leaders program, which is for high school age students who are connected to the bleeding disorders community. Generally, it's folks that either have a bleeding disorders themselves, or they have a sibling or a parent with a bleeding disorder. And then they have an opportunity to come to Sacramento and learn more about these things and participate in our legislative day, which is kind of the culmination of the Future Leaders event. So that is the registration for that is currently opened on our website. And then the Advocacy and Access Ambassadors program is one that we run year round. We have meetings every other month via Zoom to make it a little bit easier for folks, depending, regardless of where they live, to participate. And that's for anyone, 18 and older, who would like to, again, gain more knowledge about advocacy, healthcare access issues, and how they can participate. So those are programs that Carson and Leslie have participated in, and we would love to have any of you who are interested join us. So with that, kind of want to focus in on our topic for this evening, which is really about this idea of insurance and health insurance. And I think, a lot of the general public in their 20s may not think a lot about health insurance and those issues, but I would say every young person, young adult should be thinking about those issues, right? Because you never know when you might, something might happen and you might need to see a doctor or go to the emergency room or have a treatment or a procedure, even if you aren't currently living with some sort of chronic condition. But for those that have grown up with bleeding disorders as part of their life and diagnosis, I think there's a much greater awareness, right? That the health insurance and health insurance related issues are a concern. So Leslie, I'm going to start with you. Tell me a little bit about kind of what navigating that experience has been for you the last couple of years. You mentioned that you just turned 21, so you transitioned off of eligibility for CCS when you turned 21, which is something we'll talk a little bit more about in a minute. But what have been some of the challenges, and what are some of your concerns going forward as you sort of navigate this landscape of your health insurance?
So I kind of made the mistake of not staying on top of my insurance. Once I turned 21, I obviously was taken off of CCS. Since then, I've been struggling to get my care. I've been going back and forth between doctors. That was my mistake, and it was simply because I did not have the knowledge of how to get my proper care and where to go to get my proper care, or just insurance on itself. As I said, I've been pretty much going around in circles trying to get my proper care. Um, it's been a continuous pattern where I'm sent to one hematologist, and that hematologist tells me they don't know enough of von Willebrand's. I have type 2M, which is one of the rarest types of von Willebrand's. Also, being the only person in my family, I did not have the knowledge, and I wasn't prepared on how to take care of myself as an adult. Um, I basically just was running around headless. And I pressure all of you to stay on top of it, whether it is by asking us, by running to Lynn, by just calling your insurance about where to go for help, or how can you transition from CCS to GHPP. I encourage all of you to start doing that, start getting that simple knowledge, even if it's just by Googling it. That was my mistake, and I am now suffering the consequences. But luckily, Lynn has been very helpful. I'm slowly starting to get back on track, and hopefully you all take my advice and never end up in that position.
Thanks for being willing to share all of that, Leslie. I appreciate it. And we all have our points where we realize, oh, I was not as on top of that as I should have been, and lesson learned. I mean, the hard part of that is that when we have kind of, when we let something slide with our insurance, sometimes it can take a little time to unsnarl it. And get it fixed, right? Because there are things like open enrollment periods and things like that that can make it difficult to make an immediate change. But the good news is that there usually is a path forward to getting it back on track, right? And so That's some of the tips and tricks that hopefully we're going to be able to cover tonight. Carson, your story is a little different, right? Leslie is been on CCS, and because of her circumstances, you know, transitioning to GHPP is going to probably be her best option, and we'll speak more in detail about that. But you have been more, your experience has been more with commercial insurance. So tell us a little bit about kind of, you know, where you're at and what some of that looks like for you going forward.
Sure. So I didn't mention it before, but I am 22 and I just graduated from a university. Like Lynn said, I have been fortunate enough that I have had private insurance through an employer and through my parents' employers when I was younger for my entire life. I surprisingly have not had a lot of issues in getting access to my medication, but what I have run into coming from a more rural area is getting access to qualified professionals. And exactly what Leslie said, that sometimes we go to a hematologist who, you know, studies bleeding conditions, and even they don't have the adequate education or the knowledge to be able to help with what we need. As a personal experience, when I first started college and was about to move into the area, I met with a hematologist because I would be moving away from my care providers and wanted to have a doctor in the area in case I needed to speak to somebody. And I was turned away and told essentially that they did not know enough about my condition. So as a result, my hematologist is a 3-hour drive away down in the Los Angeles area. So that is really a big issue that I have struggled with and that I continue to struggle with, especially as somebody now entering the workforce who will probably be moving around at least once, if not more times, is making sure that I have care providers in my area and in the network of my insurance plan that know enough to be able to help me, especially when I have problems as somebody who has severe hemophilia. So that's just a little bit of my situation.
Yeah, thanks for sharing that, Carson. So I think that between the two of your stories, it hit on a couple of topics that I just want to point out that I think folks will want to be aware of. And if either of you have any others that you want to add, feel free to pipe in. But so you know, transition to college, right? So you might still, for example, like in Carson's situation, and he kind of illustrated this to some degree. If you're on your parents' insurance, you know, you're going to be able to potentially stay on that up to age 26 because of the ACA rules that allow that. But if you are going far away from your home for your college experience, even just a few hours in Carson's case, right? Like he had difficulty finding a provider. If you're going much further away, like say out of state, that could create some challenges for Medi-Cal and CCS kids, like folks that are on Medi-Cal and CCS. You know, you may not be aging out yet when you first start college, but you might be moving out of the area that your CCS county has providers in. Or again, with your private insurance, your parents' insurance may not have providers in the area, say you go out of state for school. So those are all things that doesn't mean that you shouldn't pursue those dreams of, you know, potentially going to a school that's farther away, but it does mean that you're going to need to do some research and figure out, like, how am I going to get my medical care and far away. Your home HTC may still be able to help manage you and be your primary HTC, but you're going to want to have a provider on the ground that is able to assist you, and perhaps they're gonna, you know, perhaps they can collaborate with your HTC in that process, right? And your hematologist can maybe, you know, consult with them. That might be one option. Again, the transition into the workforce, they made me say moving off of parents' insurance onto your own insurance. And then, you know, we've sort of talked about that geography a little bit. Is there anything else either of you guys can think of that comes to mind with that? Or anyone has, you know, anyone has any other thoughts on those that they want to throw in the chat, feel free. So moving forward, Oh, go ahead, Carson.
No, I was going to say just the only thing that I can think of is when we think of transitioning to the workforce and sort of going off of a parent's health insurance and onto your own health insurance, whether it's through an employer or private, that it's really important to make sure that you know that your medications and your providers are being covered. And there's all sorts of different categories that different things will be covered under. And so taking the time to really read through the fine print of your plan and make sure that, say, your clotting factor is covered under the category that you think it is, that it's maybe medical instead of pharmaceutical, is I think the most common issue. Doing that work up front always seems to help save problems further down the line.
100%. And we'll expand on that a little bit more in a minute. So that's great. So we've talked a little bit about CCS. Eligibility for CCS ends when you turn 21. Okay, sometimes that is a little confusing in people's heads because maybe they think it's through 21, right? Like that's a big difference. That's a whole year. So it ends when you turn 21. And so we'll talk a little bit more about, what your options are when that occurs. And then the other key transition point for California students in their 20s is related, and this is true nationally, is related to the ACA. So the ACA requires plans, requires plans that offer dependent children coverage to make that coverage available until the child reaches the age of 26. So again, that is like up to when you turn 26. And this, interestingly enough, actually applies regardless of marital status. So you could, if you got married, before you turned 26, that doesn't necessarily make you ineligible for your insurance via your parents. And this applies both to marketplace, which would be in our case like a covered California plan, and to employer plans. Okay, so what does that mean, and what are your options then if you're having to transition off of either CCS or off of your parents' insurance, right? So we're going to talk a little bit more about what this means, but that is there are commercial insurance plans. So these are basically ones that either you or your employer are paying for. So you could have an employer plan through your workplace. Sometimes the employer pays the entire premium for you. That's what you have to pay each month in order to keep the coverage active, regardless of whether you're using it or not. And then sometimes the employer pays a portion, and you may have a portion of that cost that comes out of your paycheck. If your parents have been providing your insurance, this is probably the type of insurance that you have, right? Your mom or your dad's work is helping to pay for this coverage for your family. Now, marketplace plans is the term that we kind of use nationally. In California, the marketplace is called Covered California. These are plans that you purchase through Covered California. But I will say that the state of California has quite a few subsidies that help defray the cost of covered California plans, depending on your income. So there's kind of a sliding scale in California. We're going to talk about the public insurance options. These are the ones that the government pays for, so that the state of California pays for. And typically they are based on your income, and you qualify for them based on your income. So in California, at a certain income point, you qualify for Medi-Cal. And then there's a range where you, based on your income, you may not qualify for Medi-Cal anymore, but you could qualify for a fairly inexpensive covered California plan because of the subsidies. So in California, we actually try to make it pretty straightforward for folks that are looking for coverage. And there's what we call one entry point. So there's one application that you fill out through the state of California, and then it'll come back and it'll say, oh, you're eligible for Medi-Cal, or it'll say, oh, you're not eligible for Medi-Cal, but here are the covered California plans you're eligible for, and this is how much they would cost. And that's where they kind of can build in the subsidies that you might be eligible for based on your income. The last option, and I don't say this last in terms of it may actually be the best option for many people living with a bleeding disorder. So last doesn't mean it's the last resort, is the GHPP, the Genetically Handicapped Persons Program. And this is similar to Medi-Cal in that it basically provides essentially the same coverage that Medi-Cal does in most cases. But it's specifically and only for people who have covered conditions, which includes bleeding disorders, so hemophilia, von Willebrand's, it includes sickle cell, it includes cystic fibrosis, and then a handful of other very, very rare conditions. And with this, it is not income based in the same way that Medi-Cal is. So anyone, regardless of their income, could be eligible for GHPP if you have one of the qualifying conditions. And along with that, you may have an annual enrollment fee based on your income level. So there might be a fee that you would have to pay in order to be enrolled annually. But it's usually much more affordable than, going with a private insurance plan that you have to broker on your own. So for the sake of time, we're going to jump to some of the tips here that we should follow when we're, getting ready to jump onto a new plan. So I think that Leslie alluded to this in her comments. So the first thing that's really important is don't wait for the time, like don't wait until the last minute, right? I think that all of us can have a little bit of a procrastinator in us, right? And I feel like especially when we're in sort of that college, young adult phase of life, we can be, I think I was even more of a procrastinator, like when I was in college, right? So, but in this case, it really pays to not wait because you're going to need to do some research and it's going to take some time to connect with all the people you need to talk to and kind of get all the facts together. So what that means is I would recommend that if you are on CCS, that when you turn 20, that should be your time to start figuring out what am I going to do when I turn 21 and how is this going to work? What are my best options, right? And then again, if you're on your parents' insurance and you're going to be rolling off when you turn 25, or excuse me, when you turn 25, you should start that research, right? Because you will have to roll off when you turn 26. So in both cases, that gives you like a year to really kind of, work on it, do some research, take a break if it overwhelms you a little bit, and then get back at it, right? And make sure that before that birth date comes around that you're ready to go. I got a few bullets on here. Who else, Leslie, Carson, do you have any thoughts on who else you can talk to who maybe you've gotten advice from about these things?
I think I said it before, but you were one of the most helpful people that I talked to and was able to reach out to. Um, so if that's okay with you, I would
Yeah.
encourage them to go to you.
Yeah, folks can definitely reach out to the Hemophilia Council. We're happy to help, point you in the right direction and give you some information and resources. Kirsten, did you have any thoughts too?
Yeah, I mean, I would obviously agree with what Leslie has said. I also found that for the folks that are going to university, most universities tend to have a health center. And what I found to be helpful is just talking to medical professionals of any kind, whether it be at your hemophilia treatment center or whether it be at a health center, because these are folks that are dealing with health insurance every day, almost all day. And even if they don't know the exact answers to your questions, as somebody with a very rare condition, they can at least point you in the direction of more resources. And I know that we also have some more resources further on in here that are amazing.
Yeah, absolutely. So I think providers is a big one. Providers, especially if you are at a hemophilia treatment center or at a special care center, they should be knowledgeable about these issues. I know social workers and nurses at these centers help a lot of patients with these issues, right? So they might really be able to help you navigate some of these questions and point you in the right direction. Is, you know, parents sometimes can be very helpful at, you know, not everybody's super comfortable or knowledgeable about insurance issues, right? So your parents may or may not be super confident and comfortable with this issue, but if they have helped you navigate your insurance issues, you know, all the way up until the, you know, you're 20 or you're 25, then they probably can be a resource to help you know kind of the fights that they've had and how they've done it. And that may give you some ideas. And then really just research and investigate your options, right? And that can be helpful. We did a webinar last month that was the 10 questions that you should ask when you're looking for new health insurance. And so I would encourage you in the next, you know, month or two when we get that posted to go back and look at that. But I pulled two of the most that I felt like are the most important questions to include in this webinar as well. And I think that Carson already touched on the one that we're coming to next, but the first thing is, you know, are the doctors and providers that I need going to be on this plan? So, you know, are you going to be able to access a hemophilia treatment center? Or if not, who is the hematologist that you're going to be able to go to, or that you're going to have to go to under this plan? Like Leslie said, and like Carson said in both of their stories, right? They've at times had difficulty finding qualified providers. Just because the doctor is a hematologist does not mean that they're an expert in rare inherited blood disorders. Doesn't mean that they're an expert in what you're dealing with your hemophilia or your von Willebrand's, or, you know, some of the even more rare conditions, right? Like Glanzmann's or some, you know, factor 11 deficiency or something, right? So you really want to try to ensure that you have access to a hemophilia treatment center. In California, we have a huge Kaiser network. I'm not going to say bad things about Kaiser, but I do know patients have had difficulty sometimes getting access to qualified providers because it depends. It's different between Kaiser Northern California and Kaiser Southern California, and it's different between adults and pediatrics as to whether or not you would have access to a hemophilia treatment center. So it's just something for you to be aware of as you're looking at the options. You're going to want to find a provider that is qualified to treat your condition. The second very, very important question, and I wouldn't even say that it's, you know, it might even be more important in some respects, is are your medications covered? And it's, you know, it's not as clear as it used to be. Once upon a time, it was very, very clear. If you got it outpatient at a pharmacy, it was under the pharmacy benefit, and it was usually very clear. Generics cost this much, and you know, name brand drugs cost this much, and you knew exactly what you were dealing with. But there are so many more biologics now, which are more expensive, infused, you know, typically infused medicines like blood clotting factor replacement products. And they are now being covered in different ways. So for, you know, we had a patient who transitioned onto a covered California plan, picked a plan that had a $0 pharmacy copay and thought he was good. But the problem was his blood factor was under the medical benefit and was subject to 20% coinsurance. That meant he had to pay 20% of the total cost. So he filled his first 1 month supply and got a bill for $5,000. Right. So you really want to know, like, where is it being covered, your factor specifically? And I would not agree to a plan until you've been able to confirm that information with the plan. And you may have to call the plan, and you may have to go through a couple layers of, you know, people before you can find somebody who can give you that answer. And I would also just add, like, really encourage you, get the answer in writing. Right? Don't just Don't just take what they say over the phone, but get the answer in writing. If they will only tell it to you over the phone and you can't get it in writing for some reason, then document the day and the time and the name of the employee that you talked to. So if it comes back to future problems, you have a way to negotiate that. And then we've already talked about this a little bit, right? Like, who can you go to for help? Your hemophilia treatment center, your healthcare provider. There are people called healthcare navigators that can help assist you through this process. Again, they may not have bleeding disorders expertise, so you really want to make sure you bring that front and center in the conversation, but they can definitely be helpful in understanding insurance. And insurance terms, etc. And then we don't have a lot of time to go into this. It's kind of like with Leslie's story, though, a little bit. Like, you know, sometimes you think you picked the best plan and you may end up running into difficulties accessing care. So there are some resources available if that happens. Your first line of defense is usually your hemophilia treatment center if you're at one, and then you can certainly reach out to us. There's mypatientrights.org and some other groups that can assist you and help you kind of get that straightened out, and so that hopefully moving forward you can get the care that you need. So we want to just leave folks with a few resources. There's several great resources on the HFA, the Hemophilia Federation of America website. They have a resource called Turning 26. They also have an open enrollment guide and a glossary of insurance terms that I think can be very helpful. And then coverage for people under 30 is more general. It's healthcare.gov, but that could still be helpful as well. Oh, and Stephanie made a comment in the chat, which is, I think, really helpful. And that is that you can have both private insurance and GHPP. And you can also have Medi-Cal and GHPP. So GHPP does not have to be but it can also be a standalone. So there's like different ways of combining your insurance options that may be helpful for you as well and help fill in potential gaps. So it's good to be aware of those options. And a lot of times that ends up being very individualized, what's going to be best for you based on your circumstances. But that's where a good healthcare navigator can assist with that. So with that, I just want to briefly mention, sorry, our next webinar in November is going to be a little bit more about Medi-Cal and GHPP. So if we tweet, you know, sort of piqued your interest about that tonight, but you want to learn more, please feel free to join us in November. And just want to throw it open. I know we're a little bit over time, but happy to answer any questions if anyone has any. I see that our raffle winners tonight are Hunter Estrada and Bertha Gonzalez. So congratulations to those two. Andrea will be reaching out to you. And thanks again to our sponsors and to all of you for joining us. Does anyone have any questions? Awesome. Well, thank you all for joining us. Would encourage, you know, any of you who are kind of in this phase of life, you know, get on that research and feel free to reach out directly to the council. The phone number and my email address are on the screen right now. If you have help needs or need assistance with that. And then also feel free to please help pass this information along. We will have the recordings available and would encourage you to share this with others who are, you know, in this age range and might need some assistance or some information about how to transition and avoid some of the pitfalls with their insurance. So thank you, Leslie and Carson, for joining us and helping to share your stories. And thanks everyone for joining us this evening. Have a good night.